Hi everyone, it's Dr. Shah here. I'm the Pediatric Chiropractor at White Oak Family Wellness in St. Charles, Illinois. And I thought I'd talk a little bit about torticollis today. It's something I've been seeing a lot in practice, and I thought it might be helpful to go over what it is and what you might see in your child. So I've got my little baby doll here to help us. So congenital torticollis is the type that babies are usually born with. What happens is through birth, their SCM muscle, which is the muscle that attaches right here on this bony prominence, and then it splits into two to attach to the collarbone and the sternum. It gets tight, it gets spasmed, bruised, it's just a little tender, so all of these things kind of forces it into a tightened position. So if this baby had a right SCM injury, you would see a bend this way and a turn that way, and they'd kind of be holding their head in that position most of the time. The reason it happens is just, birth is a little bit of a traumatic experience and they're coming head first, so it's just sometimes it's unavoidable. Another thing that you might notice is that because they are holding their head in this position all the time, they're probably even sleeping and laying like that. So what will happen is that if your baby is like this, they'll be on this side of the head and they'll get a little bit of a flat spot right there. Their bones, their skull bones aren't fused yet, so it's easy to kind of move them around. So if they're constantly laying on one side, it will change the shape of their head. Those are probably the two main things you'll notice early on. As early as you notice it and catch it, it's good to kind of have your child checked and make sure that that is what's going on. Sometimes there's other conditions that will look like torticollis, but it might not actually be torticollis. And in those cases, you don't want to be doing the stretches and exercises that are meant for a tight SCM. Sometimes you might also notice that the child is just kind of more turned than bent and turned. So you might have a little bit of the upper tract involved in that situation. Both are, muscles that can be treated and taken care of. At our clinic, what I usually like to do is a little bit of massage to release the muscles. We'll do stretches for each specific muscle. And then I will generally give you some home stretches and exercises that you can be doing along, in between visits. Another thing I like to do a lot is use taping. It's kinesio taping. It's a good way to inhibit the tight muscles, which you'll see on the side that they're kind of, tilting in this way. And then also activate the muscles that aren't kind of working on the opposite side, and just helps gently pull them back into that neutral, nice head position. I'm thinking of doing some videos on some home stretches just to show you guys what could be done. So stay tuned for that, and if you have any questions, feel free to contact us.